Hi, all. I am Adrian Mills, an advanced practice registered nurse, certified nurse midwife of the Spiritual Midwife LLC, located here in Dallas, Texas. I wanted to come on and talk about a topic that many midwives do not discuss often, I feel, and that is scheduling inductions or medical inductions. It is never really the desire of an out of hospital midwife to have that discussion with the client because clearly the desire is to have a birth in the home and or birth center. But there are circumstances where a medical induction that occurs in a hospital setting is needed. So I want to briefly give some tips and further information of choices that a parent has when deciding what type of induction to do. So first I want to talk about why would an in-hospital induction be indicated? What would be some of the reasons why an in-hospital medical induction would be indicated? Well, first, it could be a situation related to conditions going on with mom where an induction is indicated in order to prevent further complications for the birth giver and or the child. Situations like that, of course, the big one that everyone is aware of is preeclampsia. Preeclampsia is the big bad boogeyman that no one wants to have come knocking at their door. And whenever we are threatening to have those conditions to prevent the bigger bad wolf, which is eclampsia, an induction is indicated so that mom and baby will have a better chance of survival and or less prolonged complications in life. Another condition that would indicate an induction, and this is one that, again, no medical provider out of hospital will want to get their client in this type of situation, is when they're over their due dates. That's why when a person comes into care, it is highly important to really confirm when was conception. Are we going by the last menstrual period? Are we going by the first ultrasound? Is very good. Is very necessary to make sure we lock in those dates, because once we get to the markers of 41, 42 weeks, we don't want to compromise placenta and baby and oxygen and blood flow. Now, I myself, in my care, we've had some miracles happen. However,